Welcome to the rollout and training of two new ICEMA protocols, 8120 and 8130, also known as Assess and Refer. These are two protocols that play a very large role in the COVID-19 EMS response plan for San Bernardino County. These protocols will be put into effect upon the decision of the duty officer of the incident management team, with notification to each individual dispatch center once these protocols are active and capable of being put into use. So why develop an assess and refer policy? So 8130 is going to be assess and refer, and 8120 is going to be specific to our COVID category. The purpose of both of these protocols is to alleviate stress on what we anticipate to be overburdened emergency departments and keep emergency transport units available for our more acute calls. Also, by using assess and refer, we're going to be able to, after interacting with our patients and forming a big picture impression of what we're dealing with, we'll be able to direct the patients that meet the criteria we're going to talk about here in a minute to a more appropriate healthcare provider, i.e., we're going to tap into the patient's PMD, to urgent cares, to clinics, to pharmacies, and other services that we'll be getting into. And again, we talked about alleviating the hospitals and the transport providers. So presently, we only have a couple options when it comes to our provisions of care and refusals. Again, refusal of care, refusal of care. If they do accept transport, our only option is to take them to a licensed ED. This is not changing that. We are not going to be able to place the patient in the back of an ambulance and transport them to an urgent care. That is still under review and not available right now. A lot of this is going to be predicated on this thorough assessment, and you're going to hear us coming back to this throughout the next few minutes. We must conduct that assessment of the patient and then provide our impression once we interpret all the components of this assessment and come up with our professional impression and opinion that this patient does not require emergency ambulance transport. What is assess and refer? What is it not? It is not an AMA. After forming our impression says you are not suffering from a life-threatening emergency. It is not against our medical advice that you do not go to the hospital in the ambulance. Therefore, there is going to be no signature required from the patient when we utilize the assess and refer policies. This is all, again, AMA is all about risk and liability. There is no risk associated with assess and refer. It is our professional opinion that the patient would benefit from referral to an alternate healthcare facility. We've touched on this already. It allows us to utilize the healthcare system to its fullest capability. As pre-hospital providers, we've been slaved to the licensed emergency departments. This is allowing us to direct patients toward these alternate healthcare facilities, assist patients in accessing these healthcare facilities, and ultimately providing reassurance that these decisions are very appropriate for their present condition. The destinations or referral decisions are based on patient's condition, in addition to what are some other things that we factor in. Requests from the patient, from the patient's guardian, or law enforcement. This script appears in the policy itself. We would recommend that you print this out, maybe cut it out and tape it to your tablet so that you can use this verbatim as much as possible. This is going to be a component of your documentation later on. So it appears that you do not require immediate care in your emergency department or in the emergency department. You should seek care with your regular healthcare provider, urgent care, or clinic. If your symptoms worsen, seek medical help or recontact 911. We'll come back to this when we get into our 4-step documentation process. So to apply these new policies, step 1, is the person defined as a patient? Let's say we were dispatched to a medical aid and it turned out it's actually a public assist, public service, lift assist. We don't need to apply, assess, and refer. Does this patient have adequate decision-making capability? How concerned are you with this patient's current medical issue? If you have something that would normally apply to AMA, go ahead and follow the AMA route. Don't don't try and force it into the assess and refer criteria. If somebody's having active chest pain and they don't want to go under a fear of getting exposed to COVID, that would be appropriate to go down the AMA route. And based on the referral that you're about to provide this patient, how likely are they to successfully navigate the referral that you're going to provide? So to apply, assess, and refer, the patient must meet all of the following criteria. This is very similar to our AMA checklist. They're an adult or emancipated minor. They're alert and oriented. No clinical evidence of the list here. Again, we're going to have a checkbox. We'll get in the documentation as it applies to image trend at the end here. They exhibit the evidence of decision-making capacity sufficient to understand the risks and concerns of not seeking additional care recommendations. You'll have a section that they are not, that their decision-making capability is not impaired by drugs or alcohol. Again, this doesn't say that the patient has not had something to drink, but only that they have not consumed or impaired to the point that their decision-making capability is impaired. And then specific to 8120. So 8120 mimics assess and refer, however, it has additional constraints. Those constraints are we do have an age range. If the patient is under 2 years of age or greater than 65, we must transport them. We cannot assess and refer. If they refuse it, it's an AMA. And that the patient has no underlying comorbidities. Comorbidities, as just giving an overview, let's think about our COPD patients, our respiratory history patients, CHF, diabetes, cardiac disease, renal failure, immunosuppressed patients, patients undergoing chemotherapy, again, pointing back to immunosuppression. Think about pregnancy as well. These are just a few examples of comorbidities. It is up to you, the provider, to incorporate these into your impression. Assess and refer requires a thorough, comprehensive decision that is essentially requiring you to predict if a medical or life-threatening emergency is likely to occur in the near future when one may not exist at the time of patient assessment. Let's think about that another way. You must carefully consider your recommendation. The events preceding your arrival play a pivotal role in the total picture that you're creating. For a few examples, consider the patient with chest pain that resolved prior to arrival. I was having chest pain, now it's not here. Or a patient with a fall had some kind of head trauma and you have a report of a loss of consciousness prior to arrival, but now the patient is presenting to you awake, alert, and oriented, Glasgow 15 and acting appropriately. When you take simply a snapshot in time, you are looking at a stable patient and considering assess and refer. However, when you look at the totality of the circumstances, these are examples and only examples of patients who would most likely warrant evaluation in the emergency department. Again, this thorough documentation, we're going to now hit on how we're going to record what we've done here. We need a very thorough physical exam. Any treatment provided. If the patient fell, has an abrasion, and you dress the wound, let's go ahead and document that. Just because you treat the patient does not mean they can't fall into assess and refer. So let's make sure we document that treatment. Evidence the patient's alert and oriented and acting appropriate for their age. We're going to pick that up in our primary survey on image trend. We talked about drugs, alcohol, organic causes, and mental illness. Again, we'll be picking that up through our surveys that are already embedded in the image trend documentation. The recommendations and referrals shall be documented using the following 4-step process. The fact that you offered a recommendation or referral. And then you're going to spell out what that recommendation or referral is that you provided. Patients suffering from apparent flu-like symptoms, COVID-19 symptoms, we recommend they shelter in place and continue with over-the-counter medications. Patient understands these recommendations. Patient understands the referral. Patient understands what we've explained to them. And then after you've explained all this, what did the patient tell you? What is their plan based on your provided recommendation or referral? Patient understands and agrees, will POV now to urgent care. The name and number of any family, friend, support that is with patient. Patient left in care of daughter if we're dealing with some of our elderly people. Patient left with husband and children. Just to document, and if they're by themselves, patient left by themselves, no family or friends present. And once again, let's make sure we double back on our efforts to encourage the patient to seek the provided referral. Here are some referrals. You can go to a clinic, an urgent care, your own PMD. Let's say they just need some over-the-counter medication. We can tell them, let's take that step further. Hey, you can get this at the pharmacy, and the pharmacy is located at Walk and Don't Walk, Uber Health. And the best little secret that we have in the county, the 211 system. If you have a patient who says, well, I don't have a doctor, 211 will help them make an appointment with a provider. Well, I don't have a car. I don't have any way to get to my doctor or anything like that. 211 will arrange transportation to that appointment. And then there's a myriad of additional services. You're having a hard time securing food, shelter, behavioral health. All of that can be accessed through the 211 system. It's a 24/7 program. Again, our whole goal is to alleviate the burden on the emergency departments and make sure our ambulances remain available for the truly sick patients or patients that need our services. If the patient is having a hard time with 211, take that moment to enter them into the system. Dial 211 on speakerphone with them. Use their phone so you don't get stuck there. Here's the COVID-19 24/7 hotline. That number is there. You might want to put that somewhere that's easily accessible. And also alternate forms of transportation to an alternate transport site. Again, this all ties into the COVID EMS ops plan that is posted through Target Solutions or whatever your training platform is. This is but one component to support that plan. And again, as we see call volume ramping up and resources dwindling, this is one way that we can provide very appropriate treatment to a subset of patients here in this county. On the back end, every call that goes to assess and refer will have a 100% CQI. Part of that CQI process will be phone calls to these people. Based on your narrative, your articulated plan, their understanding of the plan, and their plan based on your plan, what ultimately happened? That's data that is going to be captured, and we're going to be tracking that. And again, we'll be looking at, hey, did we assess and refer out of this address, and now we're back 2 hours later doing the same thing. Again, it's a metric for us to evaluate how effective this policy truly is. Documentation. It is being built right now in the background on Image Trend. You may have seen it popping in and out as we beta test it. It is closely mirrored to AMA documentation. However, it's not an AMA. There will be no signature box. There will be a checklist to remind you or make sure that you have captured all the components. This is the majority of it is driven through your narrative, so it is going to take a few extra minutes as we type these narratives. We're not going to have simple click boxes for the very reason, like we said, as individual providers, you're going to have the ability to tailor that referral or that recommendation to that individual patient. Because of the autonomy this policy provides you, it's imperative that we take the time to fill these narratives out correctly so that we can continue to apply this protocol and do the best to keep ourselves available and push these patients into appropriate areas of the healthcare system. Thank you for your time. If you have any questions, please go ahead and run it up your chain of command so that we can clarify those. Enjoy and be safe.